hospitalization number. It lags the testing number, but it captures everybody. Whether they were tested or not, they still at a certain rate need hospitalization. 251 Coloradans that are currently hospitalized. So we have plenty of capacity there. There's no issues on the hospital side. What we've always been concerned about the last 2 weeks has been a trend, not the absolute numbers. The absolute numbers are sustainable. We just have to make sure they stay there and don't continue the type of increase we saw a week or two ago. We hope that there's better news soon. We won't know for sure for the next week or two. Really, a lot of the impact of the major changes, the mask requirement, that impact should just start showing up, and then the 10 p.m. last call, that'll be another week before it even starts to show up, and really probably a good 2 weeks before we start seeing the full impact of that. But we should start seeing the impact of the mask order. We probably already have in the decrease of the rate of increase. And we hope that, like the rest of the country, Colorado's been doing better than many. We're not on the travel prohibited list for New Yorkers or for Washingtonians. And that's good for economy and good for our health, because when you have people from areas with low incidence like New York that want to visit here, it's good for our economy. We'd rather have New Yorkers visit at this point than Texans or Floridians. And if we were cut off like other states are, they would not be able to come here without having to have a quarantine when they went back to New York, which effectively means no tourists. So like New York tourists are not going to Florida or Texas right now because they would have to quarantine for 14 days. So we're excited. We're on the good list. It's good for our economy. It's good for our health. But we do also have tourists from the hot spots in town. And that's one of the reasons the mask wearing requirement is so important for ourselves as well as them, that when people come to Colorado, they know that we have adopted mask wearing, and that our visitors are welcome to be safe and spend money in our state, but we need to make sure that they do it in a reasonably safe way as our guests. As we have from the very start, we're relying on data and science to really drive the decision-making process for the state. Today I'm going to walk you through some of the metrics at the state level and the local level, so you can see how that plays into some of these terms that you hear bandied about, like variances and changes in bar openings, so you can see some of the same information we look at. We're not starting the slideshow yet, probably not for another 3 or 4 minutes. There's really 4 metrics that I look at in Colorado, 4 main metrics. The first is the CU predictive model, and then of course we round that out by looking at every other predictive model that's out there. Those are all public ones. They're international, they're national. They're not as localized, they're not as accurate, they're not as granular. So the CU predictive model is the primary one, but I always calibrate that by looking at every valid model that we can look at, both domestic and internationally. That's number 1. 2 is hospital capacity. Obviously drives decision making. We do not want to exceed our hospital capacity, nor do we particularly want to have it stressed so much that we have to delay or prevent elective surgeries again, like we had to in April. So there's an absolute number where we certainly don't want to overwhelm our hospitals, but we'd rather not have to get to a point where people can't have knee surgeries and back surgeries for any period of time too. So we have sort of 2 thresholds there. The growth in cases, that is the key metric. It's more than the absolute numbers, the growth, right? It's because you can extrapolate that, because if you keep living the same way, that number keeps going up at the same rate if you don't make any adjustment in how Coloradans live, how we work, how we play. So by the time it's reached an alarming number, it's too late, right? You want to get at it to prevent that slope at a point where you can, when the numbers are still manageable like they are in our state. And then the 4th data point is what we learn from our testing results and our tracing. Now the tracing is soft data, the test results are hard data, meaning the hard data, very helpful, who and what county is positive, how many people are we testing. And in the tracing, we get some sense, not universal, some sense, where did they get it, who got it from them, who they were exposed to. So that's soft data, but it certainly is informative of where we know there are site-based outbreaks at private parties, at bars, at stores, wherever they may be. So the testing results, hard data, and the tracing results, which is soft data, and we get what we can from that. The state does a portion of that. We certainly can get that. The county part, we don't always see everything from, but we usually get enough from the counties, or at least some useful learning from the counties wherever we can. So here is kind of a little more granular level what that means. The CU predictive model, and other models, our objective is to stay above 55% social distancing. And that means, what that means for everyday Coloradans is you're having 55 to 65% fewer interactions with people than you did in January. If we can stay there and you can stay there, we should be okay. Hospital capacity, beds, both ICU, non-ICU, how quickly are they filling up or not filling up? Growth in cases, that's the trend line. We need to see how that is increasing, or we hope someday again decreasing over time. And then testing results, the 5% that the World Health Organization and the CDC have as a positivity rate for results. If you get above that, it means you need to do more testing to make sure you have adequate community screening or catching most of the catching most of the cases through testing. We talked about our extraordinary efforts to move to much faster turnaround time by using state labs. We've entered several contracts. I gave an update on that last week. We're expecting that turnaround time on tests to decrease substantially here in the next few days. Many of those to the 1 to 3 day turnaround is kind of the target there. I think one of our lab arrangements, 48 hours guaranteed turnaround. Our state lab should be back to about 2 to 3 days within another week turnaround. So for it to have as much benefit, obviously we value 24-hour turnaround where we can, but at least in the 2 to 3 day time period, you still have a lot of benefit from those results, much more than if it's 8, 9, 10 days like some of the national testing partners have. And we hope that they improve because they always have a role in overflow testing, and I think they are improving. But we have a lot more control over these contract labs and our own lab, and so we're really focused on increasing that. So getting into our drivers, we're going to talk about each one, just the 4. So the CU predictive model and other predictive models, we've had extensive presentations on that. The public is invited, the media is invited. This really looks at our current trajectory. You can even manipulate the different numbers. You can say if this many people wear masks, if there's so much social distancing. So we have a easy to use kind of public interface for that, and it's updated regularly. I would say twice a week, maybe even daily, but at least twice a week with the actuals, which lead to more and more refinement on that over time. I really want to thank Dr. Samet and his team, which really shows a model that gets better and better every week that goes by. Now hospitalization trends, and this is where we'll go to our slides. So this is kind of the in many ways one of the most important, because how many cases you detect will always depend on how much testing you have and where it is and whether people are going for it. You can't disguise hospitalizations. When people get sick enough that they need a hospital bed, they're showing up at a hospital. And so this is the uptick that we have seen since the case start counted to go up. It's also important to know that this lags behind identification. Exposure to hospitalization, 13 to 14 days, right? So exposure to onset of symptoms, 4 to 6 days. You don't, first symptoms, first few days, you don't need hospitalization. Starts minor. In some cases, it resolves minor. In other cases, gets much worse around day 6, 7, 8 of the infection. And that's where you either need hospitalization or you get better. So 13, 14 days after infection is when this shows up. So people that hit the hospitals tomorrow were infected about 2 weeks ago, right? So you won't see any impact from the mask order or bar closure on this until 2 weeks after at least when that went in. So this is a very important one that we always keep our eyes on. The next one is about the 5% and kind of how we can monitor the positivity rate. You can see that during the outbreak in April, due to lack of testing and due to a high number of infected Coloradans, the positivity rate was over 20. Now, that is what it is today in many of the hotspots in the Sun Belt, right? I don't see it every day, but that is close to what it is in parts of Florida, parts of Texas, parts of Arizona. You see 15, 20, I think they even hit 25 in some counties, % positivity rate. We have been hovering just south of 5%, which according to the best science and data means we have sufficient monitoring and testing to catch most of the cases, right? Obviously, we always want more testing, and we're working on that, but that could drive the rate even lower. But when you get down to 2% or 1% positive, you're not catching a lot more positive cases. I mean, you're giving people peace of mind that they don't have it. But what you want is everybody who is symptomatic to be able to get a quick, free, easy test. We have over 50 free community testing sites across our state. And we want to make sure that anybody who has any cold-like symptoms does get tested promptly, and hopefully we can keep that rate below 5%. Now, as you can see, we are in, the entire nation is in, a perilous and challenging position with regard to the virus. But we have time to turn it around. I think we are turning it around, and we will see in the coming weeks. But it really comes down to the biggest part of whether we turn it around is what Coloradans are doing and how we're behaving. Are we keeping a safe distance of 6 feet from others? I hope we are. Are we masking up when we leave the house? That means connecting with others virtually whenever possible. Are we protecting our most vulnerable? And are we washing our hands and practicing proper hygiene? If Coloradans can live like we did in May, instead of like we lived in July for the next month, we will be fine. May, we had a downward trajectory in the virus. We can live like that again. We must live like that again. Everything was open. It wasn't, that was well after the stay-at-home, but we need that level of precaution. But in addition to your precaution, we also need our local and governments, our counties, our cities, our public health agencies to meet the challenge. And our state is not monolithic. Of course, different counties and communities are having different levels of the virus and different levels of spread. So the response in each area should be appropriate, targeted, and of course different. And from the beginning, we've worked with counties on a tailored approach to make sure that we suppress the virus spread when and where we need to, while minimizing economic and social disruption. So that means the variances, the state and federal funding, the PPE we've supplied to local governments and counties, testing supplies, support for setting up testing sites, many other resources. But now we are at a point where there are areas of our state that need swift, targeted action at the local level to avoid far more drastic setbacks. And while the state has powerful tools at our disposal, they are blunt tools. We need to address these outbreaks at a community level. Could mean county, could mean city, before they become a regional or statewide problem. We want to perform surgery with a scalpel, not a meat cleaver, and really address where these problems are in our state. And the best way to do that is to partner with local communities and counties to make sure that we can do our part to move forward as a state. Now, as I said, every county is having a different experience with the virus. Here is a visualization of where many counties are. The green counties have a daily average of 0 to 25 new confirmed positive cases per 100,000 residents over the last 2 weeks. So this is already adjusted by population. So it doesn't just mean less populous counties are green and more populous are red. It's a ratio, right? So the green counties have very few cases. Yellow counties have a daily average of between 26 and 50 infections per 100,000 people. Orange is between 51 and 100 per 100,000 people. And red is kind of where the alarm bell should be ringing the most. Daily average of over 100 infections per 100,000 people. Now, we've granted variances to many counties, but those who've experienced major case growth will lose their variance if they can't reverse those trends themselves within 2 weeks after they reach that warning level threshold. And we know that we need to do a better job at controlling this virus locally. And frankly, every county that's seeing case growth needs to take prompt and bold action to reverse that. And in order to reverse that, counties need to A, follow their mitigation plans that our administration required, which they filed with CDPHE, and those include things like how they're going to get more social distancing, increase testing and contact tracing, how they're going to increase mask wearing, enforce social distancing. All of those things are in those plans. Now, so far, 15 counties in Colorado have been notified that they've exceeded the threshold. They have 2 weeks to, not from today, from when they were notified, to reverse that trend. And if they can't, they lose their variances. And that just simply means that counties go back to the safer at home phase, which we believe is sufficient to control the spread of the virus in those areas with the tweaks we've made over time, and obviously always looking at data to do that. We're also tracking the counties that don't have variances, and any county that has a 2-week incidence of over 100 per 100,000 people is in the red zone. So even if they don't have a variance, there's something going on there where they have an increasing and dangerous infection rate that is unsustainable. So we want to work with those counties in this critical window to get them going strong and back on track. The bottom line is the key to success has always been and will continue to be a strong local response. Local beginning in your home, your decisions, not to go to parties, not to go to events, not to hang out with others, to wear masks in public, to stay home whenever you can. City level, county level. No one wants a setback in our state from a health perspective, and we know that a setback from a health perspective equals a setback from an economic perspective, right? Just ask anybody in one of the hot zones now how their economy is doing with restaurants emptying out and theaters and gyms closing and everything else. A health setback is an economic setback. So we act to save lives, we act to ensure a robust economic recovery, and we work with our municipal and county partners to really take those steps that they need to control the virus in their area before it becomes a regional or statewide problem. I have a few other announcements before we get to questions. I'm proud to announce that the Coloradans with school-enrolled children, everybody with the kids enrolled in schools, will begin to receive their food benefits through the Pandemic Electronic Benefit Program, which is 360,000 Colorado children who are eligible, that reimburses families for free and reduced price meals that students are not getting if they're not going to school. Obviously, in some areas, they're going to school and getting those meals. But don't panic if you are a parent that relies on that free lunch program and your school district has said we're starting a few weeks later or we're virtual for a few weeks. Don't panic about the food. You will get that electronically because we can't let your children's diet and nutrition suffer just because the schools are taking a few extra weeks in your area to prepare to provide a reasonably safe environment for teachers and for students. Today is also Parks and Wildlife Employee Appreciation Day. So to all the fine men and women that work at Colorado Parks and Wildlife, as well as retirees who've given us their career, thank you. We were one of the few states to have our whole state park system open the entire period, even during the stay-at-home period. And now in the safer at home and in the vast great outdoors, so many Colorado families are taking advantage of our public lands where we have plenty of room to social distance and enjoy camping or hiking or fishing with their kids or with your grandparents or parents. It's a great way to be safe in the great outdoors. And I know that like everybody in this world, our Parks and Wildlife employees are taking on an extra strain now, right? I mean, they don't like having to go and remind people to wear masks or to be safe or to not gather with different groups around a campfire. And they know that they're taking on some risk as well every time they interact with a member of the public, just as all of our law enforcement officials are. So today and every day, we want to let our Parks and Wildlife employees know that we appreciate them. To sum up, we know that with more openings and more activity, there is a rise in case counts. You know, that's expected. The real issue is, can we prevent a trajectory where it continues to rise, right? We'd rather have 0 hospitalizations, but 240 hospitalizations is well within the ability of our hospital system to manage. If that were to double again, it would still be within the ability of our hospitals to manage. But if it was on the trajectory to double again, then it would double again and again, and all of a sudden we would have to halt elective procedures, and we would have well beyond our hospital capacity, and we could no longer guarantee what our goal is, which is every Coloradan who gets sick deserves the best and appropriate treatment, whether it's with coronavirus or whether it's a heart attack, cancer, or stroke. We need to have a hospital bed available for you if you need it, for the life-saving intervention that our medical professionals can provide. Let me do a few questions from the general public before we get to questions from the media. Zoe Sherry says, I live in Weld County and I wear a mask during this pandemic to protect my community. This isn't political. It's not right or left. It's about saving lives. I care about my neighbors. I don't want them to die. Thank you, Zoe. Residents across our state are doing the right thing. Alyssa Eastman says, I wear a mask because I have common sense and I'm an unselfish person who cares about other people. There's always haters. Don't let them get to you. Keep it up, Colorado. So that's great. And, we all hear from folks that, those who are most dissatisfied are often the loudest. But I know that most Coloradans are doing the right thing, and I want to thank you for that. Roger Siggs says, Governor Polis, you and your staff have much more patience than I can imagine. Reading these comments, he means comments on social media from scientific luminaries, advanced mathematicians and statisticians and disease specialists, yet still be focused on helping all of us. There's no way I could do that without at least a few F-bombs. And I think what he means there is there's a lot of people that profess to be experts in these different areas because they've seen an internet video. I think when you think about it and take a step back, you're not an expert just because you've seen an internet video. The real experts have studied outbreaks and disease for years. They have models to look at it from both a biological perspective as well as a mathematical perspective. They're not all in agreement, and that's fine. That's why we look at every data point we can from those who have an informed decision. And finally, there's a question, and a lot of folks ask about schools, so I'll read Andrea Hahn's question. She says some stuff that she says, have you reviewed some of the school plans? You have shown you follow recommendations by CDC and other health and science authorities. Why are schools allowed to open with few precautions in place? So there is statewide guidance for schools, and the biggest statewide precaution, this is in addition to whatever steps are taken locally, and as you know, many districts are hybrid or taking additional precautions. We're giving a mask per week to every teacher in the state. But the most important one that we want to see everywhere is cohort isolation. Fancy word, but what that means is if there's a class of 25, they need to not interact with other classes of 25. So not all together in a school lunch period, not all together at recess, not all together at passing time, making sure that if there is an outbreak, that it can be contained at the classroom level before it becomes school-wide or community-wide would be that goal. So different pods that operate, right? The kids can socialize within their pod, but not with other kids that would lead to a school-wide outbreak because of the contagious nature of that. The other piece that we will be handing to school districts and schools is the outbreak handbook. Essentially, this is what you go to when somebody has coronavirus, right? You're the school principal. In the past, all you've dealt with was probably lice and strep, right? And the letter goes out, there's a way to do it. This is worse, right? Maybe you've had measles. Maybe this is comparable to measles outbreak at your school. But many principals have not had a measles outbreak. They've just had lice and strep. But some of you have had measles if you're a school principal or teacher, and the warnings have been issued. This is one where, what do you do? What do you do? First of all, you don't panic. You shouldn't have to research what to do. Outbreak guidebook. This is what we do. How we make sure that it's locked down in the classroom. We have a surge of testing that the state will partner with the local authority when or how you might need to go online for a period of time, and how you can stay safe for your teachers, for your students. So with that, would be happy to take some questions. Yes.
Governor, Senate and House Republicans are calling for a special session to address challenges in access to education during COVID-19. Is that something you would support?
Well, look, I always appreciate when legislators want to work more and come back. And while the logistics of a session during the pandemic are hard, they're certainly not impossible. But my understanding is the Senate Democrats have already responded that they don't support that proposal to cut funding to our public schools. And frankly, that proposal would result in less choices for parents by forcing the closure of some schools and some of the online programs that already exist in our state. Certainly, if there's a state solution that I'm confident that there's a legislative majority for, I wouldn't hesitate to be open to that. But I don't think that that's an option on this. As far as I know, it has not even been discussed with members of the majority party or even ourselves. The first we heard of it was a letter. Any serious effort would involve negotiations and a thoughtful approach to figuring out a way to improve our schools. And I don't think a proposal that would reduce options and force the closure of some schools and online programs would in any way help in this situation. Parents need more choices, and many parents are deciding between online. Everywhere in our state, parents can choose online if they don't want their kids to go back to school. There are different kinds of hybrid models and full-time models, and we have open enrollment for parents to choose where they want their kids to go. Telephone?
Hi, Governor Mary Ann Goodland with Colorado Politics. I'm wondering if you would address what happened in Weld County on Sunday. As you may have heard, there were at least 4,000 people who showed up for a bull riding competition and concert, no masks required. Weld County does not obey public health orders issued by you. So my first question is, what are you going to do about a county that just completely disregards the public health orders, such as Weld County has done? My second, the Colorado Department of Public Health and Environment also refused to take action on this. So how can people be expected to obey public health orders when our own state Department of Public Health won't take action on events of this nature? This is the largest event that's taken place in Colorado since the outbreak began.
So attending large gatherings doesn't just put yourself at risk, but also puts your job and your family and your loved ones at risk. No government policy can force anybody not to be stupid, but I'm calling on Coloradans not to be stupid. You know, we're at a point where about 1 in 500 Coloradans are contagious with coronavirus. So if Marianne, there were 4,000 people there, probably 3, 4, 5 people that were contagious. And in that kind of environment, that can be a mass spreading event where it can go from 4 or 5 people to 40 or 50 people. Now, I think it's my understanding that that particular event was operating illegally without the permission of the landowner. The whole thing sounds pretty shady to me. But we are a nation and a state of laws and of order. Everything has a scientifically valid reason for it. It's really up to Coloradans. If those kinds of large gatherings occur, it's not a question of if. We're going to have enormous increase in the virus in Colorado that will overwhelm our hospitals. That's why no state of the nation is having mass events at this point in time. And that everybody from the CDC to President Trump to Dr. Birx to Dr. Fauci have all issued guidelines that would not allow for these kinds of events without social distancing parameters. So it's really unfortunate that some don't appreciate the importance of abiding by law. You know, those who choose to willingly disregard the health of themselves and their neighbors are hurting their communities. It would be one thing, Marianne, if people were just deciding, I'm going to put myself at risk. But this is more like drunk driving than it is juggling knives in the privacy of your own home. 2 examples, right? Juggling knives in the privacy of your own home, not the brightest thing to do. Might hurt yourself, but you're just hurting yourself. When you're drunk driving, you're putting yourself at risk, but you're also putting innocent life at risk. This is like drunk driving. If you party, if you go to large events illegally, you are risking the lives of innocent people in our state. And that is wrong, and we will not stand for it, and we will explore every available option to hold people accountable and protect the health and safety of all Coloradans. From the room.
Governor, CPR News posted an investigation looking at your CDPHE and a so-called brain drain that happened there with a bunch of folks leaving just as the pandemic began. The investigation talked about lack of faith in the leadership at CDPHE, both in terms of internally and externally from local public health departments. I'm wondering, if you still have faith in CDPHE, in Dr. Ryan, and also what you're doing to address these concerns from local public health agencies.
Well, look, this is a difficult time for everybody in the health profession. I mean, for nurses who work double shifts during the height of the pandemic in Colorado in April, to county health officials, some of whom have lost their jobs, have been forced out for political reasons, even though they stood by the science. And of course, CDPHE is working day and night to provide me with the information I need to coordinate with county health departments. There should be no surprise that it's a difficult time for everybody. There's a lot of frustration at the federal government because of the lack of preparedness, the lack of supplies, the lack of testing. I think that, by the way, on there's different ways to, I think looking at what they're doing and what they could do better is certainly a constructive way to do it. There's always going to be people that are when the new administration comes in that are moved around in an agency. I mean, frankly, there are agencies that we cleaned house a lot more than we cleaned house at CDPHE. We just added a few people to CDPHE, but there's some agencies where we, added a substantial change to what they do. CDPHE was not one of those. It's generally well run. They have a dual responsibility, environmental and public health issues. Jill Ryan uniquely has qualifications in both areas, both with her master's degree in public health, her work in Eagle County on the environmental side as well as on the public health side. I think everybody is strained in this epidemic, and I think everybody needs to put any beefs they have aside and find ways to work together. And that means the Weld County Commissioners, it means local public health agencies, it means CDPHE. There'll be plenty of time for post-mortem analysis and recommendations so America and Colorado can be better prepared for the next pandemic when this one is over. But it certainly ain't over yet. Colorado is doing better than most, but not well enough to rest on our laurels.
Hello, Governor. This is Vinny at Bloomberg News in Denver. Were you on today's White House conference call on COVID-19? And is there anything?
I was on the call today, yes.
Anything? Okay, good. Anything to report positive or negative from today's call and with other recent calls with governors? Thank you very much, sir.
Oh, anything about today's call, did you say? Today's call was focused on Dr. Birx's and the White House recommendation to close bars and limit the amount of people indoors and mask wearing in areas that are, showing warning signs. So we've actually taken the steps that they were recommending on today's call. The only open issue is we have some counties with variances that still have bars open that might not be able to have those bars open for much longer because unless they can turn their viral growth around some other way, they will likely need to come back to the guidance that Dr. Birx has issued nationally. So I would just say it's very consistent with what we are doing in Colorado, the national guidance from Dr. Birx. We also had a specific discussion. Admiral Gerard was on the phone. I had a call with him on Friday of last week, or perhaps Thursday or Friday of last week, about our specific partnership on testing with the federal government. We have also, as you know, we are not putting all of our eggs, or even most of our eggs, in that basket. The state of Colorado has entered contracts with private labs and beefed up our own state lab so that we can provide more timely testing and more accessible testing at community testing sites across the state. Yes.
Governor, I know you're focused on speeding up the response of coronavirus tests. Do you think that we need, or should we expect to see further testing facilities, tests available in more places, and what might that look like in the next few weeks?
Yeah, so we have to walk and chew gum at the same time, meaning that we need a wider front door and more easy testing to access, but it also needs to be processed quicker. It doesn't do us any good to have a wider front door if people aren't getting the results back for 9 or 10 days. So quick, easy, free. And we have over 50 free community testing sites across the state. Some are working with labs where they have 2 to 3 day turnaround. Others rely on national partners where they have 8, 9, 10 day turnaround. So on the ones that have 8, 9, 10 day turnaround, we are offering them to be part of some of our state contracts to reduce that to 2 or 3 days. And we are working with municipalities and public health departments across our state to have more efficient, quick, easy, larger scale testing facilities as well.
Do you have any goal for how many testing facilities you would like to see, or how that will change?
Yeah, I mean, I would look at it more in terms of number tested. I mean, there's a role for the large-scale facilities. There's also a role for community-based testing, especially in communities where people have a harder time traveling or getting out, might not have cars. That's a smaller scale, and some counties are looking at mobile testing. Others might have smaller scale community testing. But yes, we would need, we want to have several large scale facilities in the state. I'll point to a few. At the Pueblo County Fairgrounds, they have free, quick, easy testing, but they have it 3 days a week. So we want to work with them to increase that to 5 or 6 days a week. Pepsi Center, the main issue is their turnaround time. So we want to work with them. They operate well. We want to continue that, and we work with them on a plan to do that. But also to get that 8, 9 days down to 2, 3 days, and then have similar opportunities for quick, easy, free testing, no questions asked in other parts of the Denver metro area and Colorado. Telephone?
Governor Polis, it's David Clue at Denver 7. You brought up the health risks and the dangers in a comparison to drunk driving, of not obeying the mandates that have been set forth. I want to get back to Weld County because it is a red state on the map that you just showed us, and more mass gatherings are planned for the month of August. When you asked the Weld County Sheriff's Office, as we did, the health department there and the commission about this, they say your mandates are not law. They are not enforceable. They are not to be treated as such. This has to undermine the efforts of this state to try and control COVID-19. What can and what will you do if these mass gatherings continue? And so I have a quick follow-up, if I may, when you're done.
Yes, we'll give you a follow-up. So, yes, these requirements are the law of Colorado. We live in a nation of laws. Somebody can challenge the validity of that law, and guess what? Nearly everything I've done has been challenged. Some of them have withstood that challenge, some are still pending, and in one case regarding to petitioning, the court said that in fact it was not the law. That's fine. We live in a nation of laws. You don't get to choose which laws you follow and which you don't follow. Of course, we want to make sure that everything that we do is fully legal. Everybody has recourse to the courts to ensure that it is. But in the meantime, as a nation of laws and a state that respects the rule of law, of course the laws of our state need to be enforced. And you know what? Ultimately, we pay the price if we fail, right? No law can force Coloradans to do the right thing. But Coloradans should want to do the right thing. I think that, and I want to say the blame is not entirely on Weld County commissioners or Weld County Sheriff. It's also on those 3,000 or 4,000 people that made a bad decision to put themselves and others at risk by going to that kind of mass event. It is akin to drunk driving. You're not just taking a risk for yourself. That would be one thing. People want to take risks for themselves. They do it every day. But you're not just taking a risk for yourself. You are putting others at risk because of your bad decision. Follow up?
Governor, thank you for that. Also, Republican lawmakers sent you a letter today or maybe late yesterday requesting a special session to deal with school return issues. Are you in support of that special session, and what would you want to see addressed?
So look, I'm always happy when legislators want to come back and work harder, but there needs to be a path towards getting something through, not just some idea that legislators have. So the Senate Democrats have said they're against that idea of cutting funding to our public schools, but I encourage everybody to talk, because if there is something constructive that can be done, where there's a majority in the legislature around something that can help our public schools in the time of need, maybe we can find a path to do that. But look, we have a lot of choices for parents right now. If your school is going back full time, but you aren't ready for your kid to go to school, you can start out in a virtual or online program. If you don't like the one your district offers, there are many other districts and charter schools that also offer online programs. So you are empowered to make that choice as a parent. If you want your student to begin in a hybrid or physical environment or an online environment. And there's no right decision for parents. This is, it's all, if you are a kid being raised by their grandparents who are older and have pre-existing conditions, they might want their kid to be virtual until the pandemic has significantly ebbed. If you have kids that really value social interactions and need that to thrive, and you're worried about the trauma, and then you might want them to have a physical environment, which might take the form of a conventional school day in some areas, or might take the form of a hybrid, meaning 2 or 3 days of school in other areas of the state. So we are, as a state, providing a free medical grade mask every week to every teacher in the state. That begins in about a week or two. And it's a small part of how the state can partner with districts to provide a safer environment for both teachers as well as students. Yes?
Governor, you talked, oh, sorry.
Okay, somebody hasn't asked yet. Go ahead.
Governor, you've joined.
Who is that, by the way? I can't see it.
This is Cedric
Oh,
from
hey.
Denver Post. You've joined other governors in asking for $500 billion in coronavirus relief money from the federal government.
Yes.
I'm wondering what that request would look like for Colorado and what happens if that funding doesn't come.
So just today, I sent a letter to the federal delegation. I walked them through it last week and told them some of the things that it would contain. The state and city and county governments are bearing the daily expenses of fighting COVID-19, and we need our nation to act together to help. That's why the Bipartisan National Governors Association has urged an allocation of at least $500 billion, and I join the Republican and Democratic governors across the country in doing so. In addition, I wanted to direct support for the Restart Act from Senator Bennett, which would help some of the hardest hit businesses, restaurants, nightclubs, bars, tourist industries, additional help for testing and contact tracing, and additional support for our schools, and then help for housing assistance, including additional rental assistance from the federal government. So we'll be following up with a conversation with our legislators. I'm confident that the federal government will step up to the challenge that the times demand, and I hope that it meets much of the goals that we laid out in our letter to all of the members of our federal delegation. Jesse?
You talked a lot about, throughout this entire process, about local lockdowns and closing counties or cities if need be. Obviously, there's a lot of counties in the state that don't necessarily agree with these kind of meat cleaver type approaches. Weld County's one that's bucked you, obviously, on different, some of these different closures. Does the state have the ability to go into a county and say you're back on stay at home, or go into a city and say you're back on stay at home? Is that something that you've looked at as you try and wrap your hands around some of these?
Well, look, Weld County incorrectly believes that we don't have the ability to do anything. It turns out we do. And of course, whenever we issue a protection, we make sure that it's legally validated. And we've only been wrong once, right? The court's only sent out one around petitions, which I would always push the envelope for the right of the people to petition government. And I regret that that right is lessened during the pandemic because of the court's decision, but we abide by it. Every other thing that we've done, the courts have said is completely legal and valid. Doesn't mean that something else might not be at some point, but we always fully vet everything we do. And yes, we absolutely have levers in counties. Many businesses require licensing, liquor licenses, different forms of licensing that they need, and we have the ability to do enforcement through those licensing mechanisms. For instance, for a bar that is illegally open in an area of the state where where it endangers the public and is a direct threat to public health.
City and say, for instance, Denver has to go back to stay at home. Can the state do something like that, or can you only issue blanket statewide orders?
Well, again, anything that we do, I can tell you that anything that we do is fully legally vetted. And I wouldn't do it unless it had a 90% chance plus of being valid. And I think our track record speaks for itself. So I'm not going to talk about hypothetical actions, Jesse, but I would say we would only take an action if I had a very high degree of confidence that it was legally valid. Telephone? Telephone? Hello? We'll do another one from the room while we're getting that going, and we'll fix the telephone.
Who might have to stay at home with their children if it's a stay-at-home option, and they don't have the money because a parent has stopped working to stay at home.
Yeah.
At different school districts.
This is why it's important for schools to go back in a reasonably safe way. I've encouraged several superintendents, and I really want all of our districts, if they are delaying going back in person, they should absolutely try to work with other partners so that those school facilities are open in a safe way for parents who need it. It can be partnering with Boys and Girls Clubs, partnering with after-school programs that are willing to take on part of the school day. Because if you have, let's say, a third of parents at a school that need that school, you should be able to use that site. And I know DPS and Superintendent Cordoba has told me they are doing this just as they have for the latter part of summer. They are working with many providers to provide a reasonably safe environment for kids at those schools that are administered by community partners. So if a school district is not going back right away, they really should take advantage of their remarkable and impressive facilities to partner with community organizations to provide daycare and education for families that need it. We're having a little trouble hearing you. Could you speak up, please? Okay.
CPR's reporting, you saw some pretty detailed complaints from public health officials from all kinds of different counties. As the kind of boss of the state, executive leader, what do you think is causing that continued kind of rupture in the relationship?
Stress. I think everybody across our society is stressed, and I think that while there are different valid reasons for the civil distress, I think that the steps that people are taking are because of stress, and every public health official, I think that stress is an understatement right now. So of course, you know, people are going to lash out at everybody. They're going to lash out at the federal government. They're going to lash out at their own elected leaders. They're going to lash out at us. It's completely normal reaction to stress. I think the challenge that we all have, I try to avoid lashing out unduly against the federal government where I can, but there's times where I feel that it's necessary to share our frustrations with the federal government. But I think the challenge that every public health official has, and that really every Coloradan has, is to channel that frustration into positive action for change. Plenty of time to do postmortems later. There's a lot of things America could have done better. There's probably even things Colorado could have done better. But right now, we need to work together in good faith and channel that frustration into positive action to keep people safe and to get our economy in recovery mode. Thank you so much for the questions, and let's stay safe, Colorado.